Good morning, everyone. I am Dr. Heidi Goodarzi, and I am going to talk to you about being a dermatologist. I am a Harvard-trained physician and a board-certified dermatologist. So first I'm going to go over the education and degrees needed to become a dermatologist. I've been in private practice, so I'll briefly go over different types of dermatology practices. I have my solo private practice in California, so hopefully I'll be able to take you through a day in my life as well. So what is a dermatologist? Dermatologist is a specialized physician who treats diseases of the skin, hair, nail, and mucous membrane. There are about 2,000 to 3,000 dermatological diseases. So what degrees and education is required to become a dermatologist, and what does it mean to be a board-certified dermatologist? First, you need to complete a 4-year undergraduate degree. This can be in any field, but as a pre-med, there are certain courses and classes that you have to take. And then, of course, there's 4 years of medical school. Many people decide to do a year of research, teaching, or a master's degree after undergraduate or during medical school. I went to Harvard Medical School, and at Harvard, it is actually encouraged that you do a 5th year and take advantage of all the different opportunities that are available to medical students. I spent my 5th year of medical school doing basic science research in a lab at University of California in San Diego. So I was a medical student in Boston, but doing research in San Diego. During your last year of medical school, you apply to dermatology residencies and you interview at as many programs as possible. It is extremely competitive to match in dermatology, so any additional work, research, or publications that you can do to kind of prove your dedication to the field, it's always helpful. Dermatology is a 4-year residency program. The first year is a general year that can be done in general medicine, surgery, transitional year, which is a mixture of different fields, or pediatrics. However, 1-year pediatric internship programs are very few in the country. So if that's something you're interested, you need to look at it early and prepare yourself. I have a passion for pediatric medicine and pediatric dermatology, so I did my internship year at Mass General Hospital for Children's, and I can confidently say it was one of the best years of my medical education. So if you're interested, consider it. After the internship, there's 3 years of dedicated dermatology training. And at this point, you're basically a licensed physician who works under the supervision of your attendings in the hospital or in clinic. At this point in your training, after a long time of being in school, you finally feel very doctorly and you walk into the dermatology clinic as a licensed physician for the first time. But a challenge is that you walk into your dermatology residency and you realize that people are speaking a language that you have not yet learned. Honestly, I think that is the biggest challenge of a dermatology residency, is that there are these 3,000 diseases that have very complicated names, and it's not like anything you've learned in medical school before. And then there are surgical procedures you need to learn, and there is dermatopathology, which is basically the study of skin under the microscope. So the subject matter becomes a challenging one to study. On the plus side, the schedule of a dermatology residency is a lot more manageable than a lot of other residencies. Usually it's 8 to 6 unless you're on call or on consult covering 6 patients in the hospital, in which case it becomes a little bit more unpredictable. If I want to summarize the 3 years of dermatology residency, I would say, at least in my program, it is a system of gradual autonomy, which means every year you get a little bit more independent responsibility. Shortly after finishing your residency, you take a national board exam. And so if you've completed a 4-year residency program in dermatology and you pass your boards, you become a board-certified dermatologist. So all in all, it takes about 12 to 13 years of postgraduate education to become a board-certified dermatologist. So what's a typical day for a dermatologist? Well, it really depends on what kind of practice setting you choose to be part of. Hospital-based dermatologists usually deal with very sick and complicated patients that, due to their illness, cancer, medication they're on, demonstrate very complicated skin. Academic dermatologists usually have a mixture of hospital dermatology, clinic-based dermatology, and dedicated time to research and teaching. For me, I am a private practice dermatologist, so I only work in the clinic and I rarely go to the hospital unless one of the private hospital physicians needs my help. My job is a 9 to 5 job. I see patients in clinic, medical patients. I do outpatient clinic-based surgical procedures, and I do cosmetic dermatology. I do kind of a mix of everything in my clinic, but I do have to say that there are fellowships in dermatology that are additional year or years of training, then makes you focus more on one area of dermatology. There are dermatologists that only do surgical procedures and skin cancer removals. There are dermatologists that only do dermatopathology and read slides. So it really depends on how you want to focus your career. I personally have a passion for women's dermatology and pediatric dermatology. So I see a lot of young women and a lot of children in my practice. Got a question about how I chose dermatology. So for me, I wanted a visual field. I'm a very visual person. I wanted to work with variety of patient ages. Specifically, I wanted to be able to work with children. I also really enjoy outpatient medicine and I wanted to work in a clinic setting. Also, I was very research oriented and there is a huge opportunity in dermatology to do research, whether it's basic science or clinical trials. Although it's great to find a field that you really love and you really enjoy doing, I do have one advice for pre-meds or medical students or anyone trying to choose a field in the healthcare system. My advice is that you don't have to necessarily obsess about finding the perfect match for yourself. I think most of us in healthcare would be happy doing a variety of different fields. You can also follow my Instagram and ask me any questions there. I'll try to answer as many questions as possible, so send me your questions.